My name is Miroslava, and I work with Humanity and Inclusion, which is the new name of Handicap International, and I will be chairing this panel. So we'll be together for the next hour and a bit. And this session is focused on fostering the active participation of marginalized groups in health initiatives. And in several of the panels yesterday and today, we have heard phrases like leaving no one behind, making the invisible visible, bringing in people from the margins, but who are we actually talking about? So we throw inclusion around quite a lot, but I have been at an event last year about inclusive cities, and it was held here in Ottawa, but there was a local global component, and the entire session was spent discussing women's participation in politics, basically. And that's great, but we know that as women, we are diverse. And just having women around the table and pretending that that's the only thing we need to pay attention to is not enough. And so we'll try to go into more details now together. I have 4 lovely colleagues, friends together, and we're going to go through several questions back and forth. We're not going through a standard for presentation format, and we're not using any PowerPoint presentations today. Beside me, I have my colleague, Alessandra Aresu. Alessandra has extensive experience working at the intersection of gender, sexuality, and disability, and she has been working with Humanity Inclusion for the past 6 years. Beside her, Victoria Palmer from Care Canada. Victoria is an M&E specialist working both in development and humanitarian programming for the past 10 years. Victoria is currently monitoring, evaluation, and learning manager at Care Canada. Beside her, Peggy Edwards from the Grandmothers Advocacy Network. Peggy is a health promotion consultant, policy analyst, human rights activist, and author on healthy aging. And finally, Sarah Kennel. Sarah is currently the Director of Government Relations at Action Canada for Sexual Health and Rights, where she has worked for the past 6 years. So once again, thank you to each of you, and thank you to our audience for joining us. So to start things off, Alessandra, could you give us an idea of who we're talking about when we talk about marginalized groups?
Yes, thank you, Miroslava, and good afternoon, everybody. Of course, to set the scene, we are talking about those groups that have little or no access to sexual and reproductive health information and services within the context of this conference. And we have heard quite a lot this morning and yesterday about the fact that these groups are those groups that also have their sexual and reproductive health and rights violated or not fulfilled. So why shall we have this kind of panel if we already know who are they? Well, because in fact, in the big group of neglected and marginalized groups, there are many who are rarely mentioned. There are many who are somehow less included. And this is what you will hear today is about how we can reach out to them, how we can make them part of our project on sexual and reproductive health and rights. And project. And the main point to understand who are the neglected or who are the marginalized is think about why they are neglected and marginalized. Because which are the multiple barriers that these groups are facing every day when they try to access information and services on SRH. We have heard about age, we have heard about gender, ethnicity, race, marital status, people living in rural areas. For example, very little has been said about disability and about the fact that people with disabilities are part of a neglected and marginalized group that usually face challenging in reaching and accessing information and services on SRH. And when we talk about age, as someone said earlier on, we usually think about children or girls. But what about older women? And what about how are we addressing age in a way that we make sure that our project really use age as one of the elements when we work on SRH and neglected groups. Well, all of this to say, and the list that we have made is not, it's of course is not finished, but the most important thing that we want to highlight is the fact that the work that needs to be done to make sure that the neglected groups are reached by our project is working at the intersections of the different elements that we have identified. And I will express this in a way that can be understood by many, because when we think about the intersections, we think about how, with our projects, we can address the multiple barriers that people who are in marginalized groups that have, because of their gender, because of their age, because of their disability, can be really reached. And it is addressing those barriers that makes us really step forward in making the unreached reached. Understanding those barriers, without understanding those barriers, we cannot go very much far away. I give you an example of what humanity and inclusion does in this respect. We are well known as Handicap International before and Humanity and Inclusion now as an organization that addressed disability and the needs of people with disabilities in the first place. But in fact, our work is to work at the intersection of more and more, especially under our new name, at the intersection of gender, disability, and age, making sure that a girl or a woman with disability or as well as a woman who has a disability and is a refugee, or a woman with disabilities who lives in rural areas, is able to access information and services on SRH. How do we do it? We do it bringing out of the picture and highlighting and identifying which are the barriers that she faces, not only as a person with disabilities, but as a girl, as a refugee, as a person living in rural areas. This is an exercise that is not easy, but it is where we are. And why this is an important work that needs to be done. Why we say that this is important is because the majority of the projects that work on SRH today do not work necessarily on disability, despite the aim of working on the intersection of all those elements that we have mentioned. And there is a reason, and the reason is each organization has different skills, capacities, tools to put on the table, and usually we have been working in silos. And each of us working on a specific groups, joining forces to make sure that we reach those marginalized groups is the secret to make sure that those intersectionalities can be addressed. I will stop.
Thank you.
And
thank you very much. So what we start going towards is sometimes this list of intersections. So we find that we start talking broadly about intersections of race, gender, age, ethnicity, and health characteristics. And I'm wondering, Sarah, do you think that truly captures the nuances of marginalization as it's experienced within the activist communities that Action Canada allies with?
Thank you very much for that question, and good afternoon, everyone. I think picking up on Alessandra's point around how we apply this conversation from a programming perspective, that conversation could also be applied in the context of laws and policies in countries where we work, and in Canada as well. When we think about equality legislation, we're really tackling, equality between men and women sometimes, and that doesn't create, as advocates, the space for us to acknowledge and respond to the ways in which our identities intersect and the ways in which our multiple identities can come into conflict with one another, or create legal and policy barriers in relation to the full exercise of our rights, or in terms of accessing health services and other services. So in the context of sexual and reproductive health and rights, I'd call on us, in order to have this conversation around the intersection between multiple and intersecting forms of discrimination and inequality and marginalization, to frame our rights analysis around the ways in which everyone has a right to bodily autonomy and to have full control over and exercise and on all matters and make decisions around all matters related to our sexuality, our gender, and our reproduction, free from discrimination, violence, and coercion. And when we look at it in that framing, we're able to see the ways in which we live our identities and how those identities can create barriers or facilitate our access to health information, our ability to exercise our voice, and our ability to claim our rights. And again, if we position SRHR, sexual and reproductive health and rights, in that way, I think that we're better positioned to have a conversation around the structural inequalities that underpin and root systems of power that are often grounded in social constructions of gender that seek to control women's bodies and choices. So looking at kind of, if we're pulling back a little bit in terms of where we've seen movements adopt this approach and with considerable success, I can think of two. And the first is the reproductive justice movement. It's a movement that came out of the United States, and it brought together feminists working at the intersection of sexuality and gender, and Indigenous folks, and Black women. And really, their premise is that sexual and reproductive health and rights cannot be viewed as a health issue alone, but rather that the full realization of sexual and reproductive rights ties to the ways in which we're able to support our families and our communities and exercise full choice as Black women, as Indigenous women. And so I think it's important for us to acknowledge the work that's already been done at the intersection of these communities. Also, the Latinx community that I think at its core seeks to disrupt gender binary, recognizing gender as a fluid concept, and one that's also rooted to deeply held experiences of cultural and linguistic marginalization. So how can we situate ourselves within those communities and within those experiences to be able to advocate for greater SRHR? And I think by adopting an intersectional approach, and one that that recognizes the layering of marginalization and discrimination, helps us look at other communities within the SRHR field that we have traditionally seen within silos. So if we look at the rights of LGBTQ folks, the ways in which we've been supporting that movement have often been in terms of supporting gay men or men who have sex with men. And we see that in terms of where funding has flowed as well. So by taking an intersectional approach, we're able to look at the diversity within communities and ensure that we're tailoring programming or advocacy to meet the needs of those entire communities. An intersectional approach also helps us look at gender equality from a different perspective. So recognizing, again, gender as a fluid concept rather than the traditional men and women binary. And in doing so, we're able to then create space to talk about trans folks and intersex folks in a way that brings them into the conversation and into those decision-making spaces. The final comment I wanted to make on this is that an intersectional approach doesn't just apply to programming. I feel strongly that it starts with me as a white woman living in Canada and holding a high degree of privilege, and that we as individuals working in development need to take responsibility and take accountability for that. And so acknowledging our own privilege in this conversation and how that plays out in the decisions that we make from a programming perspective, I think help us and strengthen our ability to look at intersectionality from a more meaningful place when we do our work.
Thank you very much. Now I'm curious, Victoria, from your perspective as somebody focused on monitoring and evaluation, could you give us an idea of how this type of marginalization and the complexity of the intersecting marginalizations are reflected in data collection methods and tools?
Yeah, thank you, Miroslava. So for me as an M&E person, when I'm thinking about designing an M&E system, my starting point is going to be the theory of change for the project and the logic model, the PMF for the project. So I feel that if marginalization has been taken into account in the design stage, then that should automatically be reflected in the tools that we're collecting to measure against our performance measurement framework. So I think, for example, at CARE, where I'm working, we're a gender-focused organization. So that's reflected within our logic models, and that gives us the impetus to have a gender lens for our entire monitoring system. So whether it's collecting data, whether it's designing the tools, when we're looking at how we use that data, how we interpret it, and how we analyze it, the gender lens is really going across the monitoring system. And in addition to that, we also have gender strategies for every project. So we have gender-specific indicators, which are formulated against the same outcome statements as we have in our logic models, but really focusing on gender at every level of the results chain. And I work in the global health unit, so the programs that we have are intended to be gender transformative. So that means we also need to be able to measure women's empowerment and gender equality and how that's changing throughout the life cycle of our project. And we've looked at different ways to do this. We've used qualitative and quantitative methods. So I wanted to give an example of some of the projects that we're working on at the moment. So we have 2 nutrition projects, which are funded by GAC. There's the GROW project in Ethiopia and the SANI project in Mozambique, Malawi, and Zambia. And this is the projects that Peter actually referred to this morning when he was talking about the DHIS2 system that we've been developing. So in the baseline, we did a quantitative baseline for these projects, and within that we touched on questions to do with gender, and that gave us some useful information. But what we were missing from the quantitative study was a real understanding of the barriers to women's empowerment, the reasons behind women being marginalized in the countries where we're working. So we also did formative research in the 4 countries where we're working, so that we could really get a more in-depth contextual understanding of those kind of barriers. And we decided to use photo voice as our methodology for that research. And the way that we used photo voice was to train 74 women across the 4 countries on how to use cameras. They were given 1.5 days to take photographs within the community. And they were instructed to take pictures of things in the community and in their home which represented attitudes and practices around nutrition. And they were asked specifically to think about what makes an ideal man or an ideal woman in terms of nutrition, or what challenges do you face around food and nutrition within your family. And they came back together with the photographs that they produced, and then focus group discussions were held with those women to talk about the photos in more depth and to get that more in-depth understanding of what they'd witnessed within their homes and their communities. And then focus groups were also held with their husbands and also with the mother-in-laws, because we recognize that those are the 2 groups who kind of hold the most power within the families in those contexts. So the photographs were a really useful tool to generate more in-depth discussion. They were very useful to have a visual not only for the focus groups, but also for us sitting here in Ottawa to have a better understanding of how the everyday lives of the people in these communities. And we managed to get some really rich data from those focus groups, which was useful for our programming. And some of the issues that came up within those focus groups were things that we hadn't been aware of before. So this is where it becomes key that qualitative data collection can give us a chance to discover new issues of marginalization, things that we didn't necessarily know about when we designed our project. So I can give you an example. In Malawi, we found out that some women were engaging in transactional sex in exchange for food or for a small amount of money. And this is because the women were kind of saw that as preferable to taking on informal labor in the GANU labor system, which is very exhausting work, very difficult work, physically demanding, and it was just something that they felt it was preferable to take a boyfriend, as they called it, who would give them something in exchange, maybe a bag of flour or a little bit of money to buy food when there wasn't enough food in their home. So this was a really serious issue which we hadn't necessarily been aware of before, and we needed to make sure that we took that into account. So this is when we're able to take the results from that qualitative study and feed that back into our implementation and our design. So we managed to adapt our gender strategy, which we'd had for the project. And the key thing for us at CARE is that we have staff who are dedicated to gender. So within the team here in the HQ and also in the country offices, we have gender staff and M&E staff who work very closely together, who have the time and the resources to put the thought into adapting those strategies. So they could look at the issues that we'd identified in the qualitative research, think about what new strategies we needed to put in place to address those, and then think about how we could change our implementation based on that. So I think the key thing that I wanted to stress is that the qualitative research can really have that ability to open up issues of marginalization that hadn't been seen before. You know, marginalization is by definition hidden. So if we want to give participants and the community a chance to identify types of marginalization, we need to use qualitative methods which have that space and help us discover. And we need to always remember that we don't know what we don't know when it comes to marginalization.
Thank you very much. So, Sarah, Victoria, you've spoken more about the nuances of gender. And I think that that's very interesting, particularly for many of us here who work with Global Affairs Canada, who expect data to be disaggregated, yes, on gender, but also on age. But Peggy, I sometimes wonder that talking about age and gender does kind of become a shortcut of talking about women and children, when really gender and age should take into account much more than that. So if you could please speak to us about your experience working with grandmothers worldwide.
Great, thank you. Welcome, thank you. Just before I get into the data question and build on what Victoria was saying, I'd like to say two things. First of all, when I talk about older women, it's a huge, diverse group. The UN has a chronological point. It's 60 and over are considered older women. But this is a huge, diverse. As you know, life in your 70s is very different from life in your 80s. It includes all gender identities. It includes very many women with disabilities. So, yeah, so there's a lot of overlap. The second thing I wanted to say is that I'm wearing this T-shirt for a reason. You can see what it says, right? Older Women Count, and it's in Spanish on the back. This was a slogan that was developed at the UN by an advocacy group for older women. And it's a double entendre, in the sense that older women count because they're so important to their families, to their communities, to productivity in their countries. But secondly, because older women are rarely, very rarely actually counted. And that's the key point I want to make, and I'll use the example in sub-Saharan Africa and other low or moderate income countries. There is very little or no data collection on sexual health, HIV status, and the experience of sexual violence against women over the age of 49. Nor is there any comprehensive information, data on the number of older women, grandmothers, who are caring for children who have been orphaned by HIV/AIDS or affected by AIDS. And many of those are young women who are in dire need of sexual and reproductive health services and education. So as a result of this, because we don't have the data, older women are invisible to policymakers and organizations and developmental assistance. So they're denied basic services and protection of their sexual and reproductive health rights because they're absent from the official records. So why does this happen? There's lots of reasons, lots of barriers, but I'm going to suggest two. The first is ageism. It's a prejudice, a discrimination based on age, and false beliefs that sexual health is irrelevant to older women. You know, we don't engage in sex, or we don't have sexual health needs after the reproductive stage of life. And we know that this is false, but it's still a very common myth all over the world. Secondly, is that most of the indicators and the methods that are used in low-income regions in particular, and suggested in the Sustainable Development Goals, exclude older people. So for example, the African Demographic and Health Surveys, which is a really important source of information on sexual health and violence against women, includes only women aged 15 to 49. Anyone over age 49 is not included in the sample. So we need new ways, different ways of analyzing information. Data collection must include people over the age of 49, and all data must be desegregated by gender and age.
Thank you very much. So I'm wondering, given these complex web of prejudice, this complex web of prejudices, what does taking a feminist approach here in Canada have to offer us as we seek to address marginalization and inclusion? And I'd invite Sarah for you to start us off with that.
Thank you. Yeah, I think it offers a lot of opportunity. And I think it requires us to acknowledge two things. The first is, what is a feminist approach? And to me, that's one that's grounded in the principles of agency, choice, and empowerment. And we need to be looking at those in terms of the ability of folks, regardless of their marginalization, to be able to exercise those principles. And the second, in the practical application of a feminist approach, it requires a rights-based approach. And to me, that means positioning the individual, recognizing all of their intersecting and compounding identities, and positioning them at the center of decision-making, and recognizing them as full rights holders, and positioning them to be able to exercise the full spectrum of rights. So from this perspective of implementing sexual and reproductive health and rights, I would call on us to apply those theoretical principles in a practical way by shifting our thinking from a supply-driven approach to a demand-driven approach. And doing that really, again, seeks to put the individual and their needs and experiences and realities at the center. And it also forces us to avoid verticalized or siloed approaches and rather look at programming from a holistic or comprehensive or integrated manner. So for example, when we talk about the delivery of contraceptive supplies and information, this requires us to look at how we need to shift or work towards shifting gendered power dynamics and decision-making at the level of the individual and the household, and recognizing the ways in which issues of marginalization play into those power dynamics. It also means working with those seeking services to ensure that they know what services they are entitled to, where they can access them, how they can access them, so ensuring that they are empowered with the information. They also need to understand the methods available to them and what the range looks like and from a rights-based perspective. Similarly, in the case of sexuality education, many programs that we see in Canada, this is certainly the case, is that sexuality education programs are delivered in gym class, where often students with disabilities are removed from those classes. And so how are we ensuring that all students are able to exercise those rights when they're pulled out of those classes? So speaking again to the sexual health needs of all individuals. Again, coming back to the issue of what adopting a rights-based approach looks like, when we talk about the right to health, it means ensuring that services are available, are accessible, are acceptable, principle of acceptability, and are of quality. So every single sexual and reproductive health service that we're delivering needs to be measured up against those criteria. We also need to acknowledge the ways in which the right to health impacts other rights, the right to food, the right to housing, the right to education, and how that impacts on the right to health. Again, adopting an intersectional approach. And all of this requires that governments ultimately, and this is where I'm coming from as an advocacy organization, governments need to take responsibility for acknowledging the ways in which people aren't able to exercise those rights and take steps to remedy the situation through legal and policy reform. I'm done. Okay.
Yeah. All right. I would just ask Peggy for you to come in for a moment. Do you think that the perspective that older women, does the perspective of older women have something particular to add in terms of initiatives that take on a feminist approach?
Oh, well, I'll make 2 quick points, I think. First is to verify that definitely feminism and human rights are 2 parallel concepts that have to be integrated and used together. And what we hear from grandmothers is, particularly in sub-Saharan Africa, because that's primarily who we work with, is that the most effective way to move from the conceptual and the theory into practice, which you talked about, is to support those community organizations on the ground. They are the ones that are really understand they may not understand all the concepts, but they're the ones that are empowering women and all genders. The second thing I want to make, and I'm going to maybe sound like a broken record, but a feminist approach has to embrace all ages. You know, when I was preparing for this, I took a look at the Global Affairs website and the international agenda, the Feminist International Agenda. And it says very clearly there that one of the main goals is to support the poorest and most vulnerable. Well, the research shows us very clearly that grandmother-headed households and older women living alone are the poorest of the poor. And yet, when I went through the website and I played the video, there was not one single image of an older woman.
Thank you. Now, Alessandra, from a programming perspective, having worked with international associations, but also with community organizations, what do you think needs to be kept in mind if we want to be true to this feminist approach, to a rights-based approach? What needs to be kept in mind in order to plan and implement truly inclusive health initiatives?
So if I think about three keywords that and three concepts that I would use when I think about health inclusive project, is certainly participation, accessibility, and non-discrimination. And this is true when we discuss about disability inclusive health project, as much as for all the other groups that we have mentioned today. And maybe these are concepts and words that we think we understand clearly, but it's worth spending 30 seconds on each as a minimum to really understand what we are talking about. Because participation means that the marginalized groups are part of the project from the design to the implementation to the monitoring and evaluation. And this is not always happening, even if we truly believe that this is important. So thinking about the group I work with most of the time, that are people with disabilities and women with disabilities and girls, it is important that when we say that we want to have a disability inclusive health project, then they are with us from the beginning to the end. And especially if you are running a research, then your researcher should be not only trained on disability, but they should be people with impairments that can fully understand how the questions are posed or how the situation of the community that they are going to interview is. That can be participation and indirect or direct participation in your project or in our project. They can be directly involved, and the representative of the organizations, for example, disability people organization disabled people organizations can be represented through one or two people from the different groups. So this is extremely important. The second element, that is accessibility. We always talk about accessibility, but if we don't look at what does it mean, barriers that prevent people to access information and services on SRH, then we don't go very far away. And again, the studies, the research, the project that I have been looking into, which are the real barriers that prevent the different groups to access information and services, again, are very limited, especially for the groups we are discussing here today. And non-discrimination, well, of course we work in a non-discriminative way, but let's put it in a different way. The barriers we look at and we want to address, the roots of those barriers are linked always to discrimination. So if we go to access those barriers without being fully inclusive, our project will not address the discrimination and the stigma that we are talking about. And I make a very clear example. We work on gender and transformative project, and we always say that this is a key point. If we do not bring together gender and disability, and therefore we do not promote a disability transforming project, we are not addressing those elements that do bring discrimination and stigma against people with disabilities. So being gender transformative, but also transformative in the way the community and the world that we are trying to influence work on disability is also extremely important. That's why we need to put them together.
And I'm curious, we've heard about data around age, around gender.
Yes.
Do you think that data, lack of data, improper data around disability is complicating factors, or do we have that sorted out?
It is one of the main complicating factors because the data on disability and on specifically disability and SRH and the needs and the way women and girls with disabilities, for example, are discriminated against are very limited. Definitely, there is way to collect data, but they are often considered challenging. So collecting data that are disability disaggregated data is the first step to address and to be inclusive in the way we are talking about. And there are ways to do so. There are tools that are available that are usually not fully, the main actors that work on SRH are usually not very familiar with these tools. One of them is the Washington Group questionnaires. But they are there, and they are there to be used, and we can maybe explore a little bit more if we have the time later.
Thank you. So we have a lot of work to be done on the disability disaggregated data. We still have a long way to come on age. Victoria, do you think that we've arrived in terms of gender, considering how much time and energy has been invested on that?
Well, yeah, I think that we have a very good idea of what we should be doing for gender from the M&E perspective, and I think we are doing a lot already, but there's obviously always room for improvement. So at CARE, we have a gender marker tool which we use across CARE globally to score each of our projects on an annual basis to see how well gender has been integrated within the projects. And part of this, and that would give a project a score from harmful in terms of gender up to transformative, which is obviously what we're aiming for. And part of that tool includes looking at the M&E system for the project and assessing whether that system is actually supporting the project to be gender transformative. And that sets out 4 things that an M&E system should be doing if it's going to support gender transformative programming. So firstly, it should be monitoring changes in gender roles and relations within the community, which I think is something that we're doing in the projects that I'm working in, we're doing. It should have sex and age disaggregated data, which I think is very standard for most of us in our programs. And it should be monitoring unintended consequences of the project, whether that's positive or negative. And then finally, an M&E system should also be able to spot new emerging protection risks and protection concerns. So as I said, I think for us at CARE, at least, we're doing some of those well, and some we're maybe improving on or trying to do better and learning more about how we can do that. I think it's quite ambitious to have an M&E system that can do all of those things. So I think, but it's very useful for us to at least have that defined so that we know what we're aiming towards. And I think it's good that we are holding ourselves to account against that, because we're obviously collecting data from people in communities where they don't necessarily have a voice to hold us to account, especially women in these communities. So the fact that we're actually looking back and reflecting on the M&E systems we have, I think is really important. But that's thinking about how an M&E system can support a gender transformative program. And from my perspective as an M&E person, what I've been thinking about recently is how could the M&E system itself actually be gender transformative? So if you're somebody working within that M&E system, or if you're partner staff implementing the M&E system in the field, how could being involved in that M&E system actually be gender transformative? And I think it's important to think about the kind of methods that we use, the way that we train our staff, the gender balance within our teams when it comes to thinking about that. So I think I talked before about photo voice as a qualitative participatory methodology, and I think Alessandra touched on this as well, that participation within those methods can be really powerful for giving people, or women in particular in our case, a sense of empowerment, a sense that their opinions matter, that they're listened to. So I think those participatory methods are really important in terms of how we do M&E. I mentioned having a gender balance within the team, which is something that's obviously very important so that we can reach women and have women participating and feeling comfortable. But I think that's something we do struggle with in a lot of contexts. So I'm wondering if we could be more proactive in how we get women involved in M&E, or provide kind of training or capacity building, or kind of reach out more to get more women interested in M&E. And I think, finally, something that would be really interesting would be to encourage the staff who operationalize the M&E system, or even ourselves when we're collecting data, to think more reflectively about how we as individuals have an influence on the way participants answer questions. So what kind of assumptions do we bring when we come to the field maybe about gender norms or social norms? How are we influencing participants in the way that we ask our questions and the way that we interact with them? So I think having that kind of critical reflexivity within the M&E team would be really important. And then I think potentially there is a way that M&E in itself could become gender transformative, which I think is quite exciting.
Thank you. So we've spent some time really focusing on data collection, the importance of numbers, because it's one of the cross-cutting priorities, I think, for all the different issues that we're touching upon. Because if we don't, because governments want numbers, donors want numbers. If we don't have those numbers, then we risk continuing to try to argue for causes without being able to show the facts that people want. So I hope that gives you some ideas of how this is being tackled, and also the goals that we're working towards, to move away from gender binaries, to work towards not only tracking of older, younger, but looking at everything in more of a spectrum, and being able to capture more nuances and more details in terms of age, disability, gender, and on and on and on in our data methods. But obviously there is more to our programming than data collection. So in addition to that, I'm wondering, I'm looking for more recommendations for ensuring that the different constituencies are included in sexual reproductive health and policies and programs. So maybe, Peggy, you could start looking specifically at older women and beyond data collection. What is being done? What more can be done?
Okay, I think the most important thing is to adopt a life course approach in policies, programs, and strategies. And a life course approach understands aging and cumulative advantage and disadvantage as a process that spans the whole life course, okay, from beginning to end. And it provides supportive policies and activities at key transitions in life, key transitions in a woman's life. This isn't the same thing as a life cycle approach, which I've seen described at this conference, which once again falls back on looking at children, adolescents, and women in the reproductive stage of life. A life course approach looks at it from beginning to end. So we in the Grandmothers Advocacy Network, we don't just advocate for issues for older women. We're very concerned about things like child marriage, because we know what the results are going to be down the road for older women. So you need to take a life course perspective. That would be, to me, the most important thing. The second thing in terms of older women would be to say, we need to put more emphasis on some of the issues that are specifically important in older age. And some examples: vulnerability to violence and abuse, land grabbing, harmful traditional practices, such as wife inheritance and accusations of witchcraft. We need more education and lifelong opportunities to learn about sexual and reproductive health, both for ourselves and for teaching the younger generation. Inclusion in STI and AIDS testing services and treatment. Older women are the last to get tested and the last to receive treatment. Sexual health problems and incontinence resulting from early marriage, poor maternal care, sexual violence, and the normal physical changes associated with aging. We need a lot more emphasis on the non-communicable diseases such as breast and cervical cancer. Sensory declines and disabilities occurring in older age. In Canada, 1/3 of older people, that's both men and women, have a mobility disability. And I remember I was at a gathering in Swaziland, and very fortunate, there were 15 Canadians, and we were witnessing, there was about 700 African grandmothers there. And I looked out and I realized that every single one of the Canadians was wearing glasses. and there was probably only 2 pair of glasses amongst the African grandmothers. Such a simple thing, but not available. Okay, I'm finishing up. The lack of Social Security and pensions needed to alleviate poverty. And very important, access to age-friendly universal health care. I know there's a lot of discussion here about universal health care, affordable medicines, the importance of dignified long-term care. But again, older women are often left out of that. It has to be age-friendly.
Thank you. Sarah, could you tell us a bit more about Action Canada's experience specifically using advocacy as a tool in addressing issues of marginalization and inclusivity?
Thanks. Yeah, and I think it's grounded in having the data and the research available to us to make those cases, to engage in effective legal and policy reform. And just before we move on from the data piece, I also wanted to flag that there, often when we're talking about issues of marginalization, there can be safety concerns, right, and how we collect data. And I think we're obliged to be able to take those issues into consideration when we're engaging in data collection. So for example, what are the risks associated with talking about LGBTQ communities when we collect data, especially if we're presenting that data back to government? Is that an outing exercise? In certain political contexts, that could be. So just being mindful of that. And I think where, from Action Canada's perspective, where we see the most need for advocacy in the SRHR context is really in the protection gaps. And again, it speaks to a data issue as well. If we're talking about gendered data collection, we're often looking at men and women. Again, if we're going to take a feminist approach, that requires us to expand that binary to include trans and intersex folks. And again, if we're going to go and present accurate evidence-based advocacy strategy, or engage in effective advocacy, we need to have that disaggregated data. So in terms of our approach to advocacy, again, it's about holding governments accountable to their human rights obligations. And how do we do that? We can leverage mechanisms at national, regional, and international levels. Some areas of success that we've seen include using the Universal Periodic Review, which is a process that happens every 4.5 years, where states are evaluated against the full range of human rights. Treaty monitoring bodies similarly. So how can we leverage international mechanisms to hold our governments to fulfilling the fullest extent of our human rights? Some of the protection gaps that we think are priority areas include not only LGBT rights in their fullest extent, but also the rights of married adolescent girls. So recognizing that prevention of child marriage is a huge priority, but what happens in meeting the needs of those who are married already, and certainly those who have been married for a long time. Married women are often left out. We also talk about the criminalization of LGBTQi issues and how that, implies other criminalizations, including criminalization of sex workers inadvertently through those laws and policies. In terms of other strategies that we've seen effective at the local level and national level is engaging with in strategic litigation. So working with lawyers collectives to address legal and policy issues, working with regulatory bodies, so colleges of physicians and surgeons. Often that's an effective way to hold healthcare providers accountable to delivering rights-based healthcare because that's where physicians and all healthcare providers are accountable to, or that's their accountability mechanism. We also, the final point is in engaging in advocacy, especially from an intersectional approach, the issue of cross-sectoral and cross-movement solidarity is essential. So, a prime example is the work underway in El Salvador on the criminalization of abortion. And that within the context of the progress they're seeing in El Salvador on LGBTQ rights. So how can we be bridging those two communities in solidarity to advance a collective response around SRHR, recognizing the intersections between those two movements.
Thank you. So in a few moments, we'll be opening up the floor to more questions so that we can get you part of this discussion as well. But before I did that, I just wanted to see if you wanted to add any not quite final thoughts because we'll be responding, but just from our end, anything you felt like you had missed out till now before we open up to the floor?
Is this our concluding remarks?
Again, not a final conclusion because we're going to have a full conversation with everybody here, but just anything that you feel that you've forgotten or left behind before we head to questions. Please.
Yes. I think there is one point that is the main one that I should have started with, but it's good to keep it at the end so it stays fresh in the mind of people before leaving. Often, people with disabilities in general, women and girls for sure, are not considered subject of sexual rights. And that is the origin of sexual and reproductive health and rights. And because they are usually not considered sexual subjects. What does it mean? Is that the overall idea is that people with disabilities are asexual or, because of their impairments, they may not get married, they may not fall in love, they may not have a relationship, and therefore, what's the need for them to get access to information and services on SRH? So the point goes back on rights, the rights-based approach, and the advocacy part that we have been discussing, the advocacy aspect. And that's why within Humanity and Inclusion, we work not only on promoting the accessibility and increasing the accessibility of SRH services for people with disabilities, but to advocate for the rights of people with disabilities and women and girls specifically in this context, their rights to sexual and reproductive health in general and access to information and services. And this is the key message I want to use to convey before closing. Thank you.
Please.
I'd like to just add to that the importance of older women as as allies in this advocacy and with all these various populations. We grew up with the women's movement and the peace movement. I've talked to some women who say, it's kind of in my DNA. We have a lot of experience, but now as older women, we are very concerned about the next generations. And we're working closely with young people and our grandchildren in particular. I'll tell you a quick story. Last week, a woman called me. She was all excited. We're working on a strategy for generic medicines. And she said, I put it up on Facebook. And it was a feminist message on Facebook. My grandson picked it up, and he sent it to 200 of his friends and his high school teacher. And he changed the title to say, Granny's Gone Political Again. So just a nice quote from Gloria Steinem. She said, about 20 years ago, she said, someday an army of gray-haired women will quietly take over the earth. The time is now.
Thank you.
Yeah, I think just, I've been talking a lot about what M&E can do and thinking kind of in an ambitious way about our M&E systems. But I think one thing that I need to emphasize is that what we've been able to do at CARE and what we're hoping to do in the future, it all takes resources. We're lucky that we have staff dedicated to gender and we have staff dedicated to M&E within our projects and at the head office level. And, we've managed to do studies, but it does, it takes time, it takes money to do this kind of work, and we need that kind of data, especially the qualitative data I emphasize again, because I think there's still a bit of a gap in some of our programming. We really need that data to understand the communities we're working in, to see whether or not our implementation is happening in the way we wanted it to, and also, to understand marginalization better within those communities. So making sure that we secure those resources is really key to having quality monitoring and evaluation, which is obviously essential for the programs we're working on.
Thank you. Sarah, did you want to add anything before we open up the questions?
Maybe just one sentence around laws and policies are often the perpetrators of marginalization or uphold existing forms of inequality. And I think that's why advocacy from an intersectional approach is so important, advocacy targeting laws and policies.
Thank you. All right, so we have some time for a broader discussion with you. I see one mic on this side, one mic on that side. I'm sure that if you can't get to the mic, if you wave, somebody will help you get the mic to you. We'll take more than one question right off the start. So we'll start with you, seeing as you're up there. But if at the same time you wanted to get to the mic, we'll take 3 questions and then move on from there. Please.
Hi, I'm Christiana from Results Canada. I'm really not sure what my question is yet, so I'll formulate it as I go along. Sarah, you had spoken kind of at the beginning about the concept of gender and how, as we know, it's a social construct and very much is determined by the individual themselves and how they feel and reflect to, how they identify with their own gender. And one of my issues with the Feminist International Assistance Policy and the language around gender equality and empowerment is that we're sort of kind of basing this idea that gender is binary and that when we talk about getting there, talking about realizing gender equality, we're assuming that it is only binary. So I guess my question is, how does the language itself limit how we measure gender equality? And maybe from a MNE perspective, how do we kind of gauge transformation when the construct of gender itself is fluid? Is that a question that we kind of let the population we work with define what that gender is or what it looks like, what that transformation looks like? Or is there kind of still room to kind of delve out into the concept of gender itself?
Thank you. Any other questions that people want to ask right away? Oh my goodness. Wow. Okay. If I could tag on to that, just when you're answering that, I think that the other thing that I would love to hear about as you're answering that is as we go towards these goals, if any of you have experience tackling this kind of transformative work, but with, how do you balance the desires of like the mainstream predominant community and priorities and the kind of intersectional inclusive ideals that we're trying to push. Like, to make this more concrete, we're talking about disrupting gender binaries. A lot of the disabled persons organizations at national levels in the places where I work are very conservative. Like, just because somebody's in a wheelchair does not mean that they're progressive, unfortunately. Some maybe, some aren't, but it's not, one is not going to have an impact on the other, unfortunately. So if you could, in your answers, also speak also to experiences of the competing maybe priorities within some of the communities that we work with as well.
Could I start? Is
Please.
That okay? Thanks. Just to jump in there and assert my privilege. Sorry. I think the feminist internet. I think Christiana, you just. Thank you. Sorry. Thanks. I think that's an excellent question, and we could have a full day talking about the implications associated with the adoption of the word feminism into a development policy. And I would hope that we could have space to have that conversation in a more fulsome way. But I think by nature, a feminist approach is long-term. I think it requires long-term investment. It requires long-term planning. And I think that we're 1 year in, 1.5, 2 years into the policy now. We do need to give ourselves time to let that sink in, and for us as activists and organizations to be able to apply that. That being said, I think that there's space for us to push donors in terms of, to your point around data collection and expanding the binary. I think that that's our role as organizations, as nonprofit organizations, that we need to be engaging in conversations with those in decision-making places to be able to bring them along, and that's on us. I don't think that we can escape that accountability. If we are going to apply from a feminist perspective, we need to take it seriously. And the third response, I would say, is the importance of supporting feminist organizations. I think they're the ones at the forefront of doing this work in a meaningful way, and they're the ones who live these realities all the time, and yet they're the least resourced. They have very little access to formal decision-making spaces. And so how can we come up with strategies to support the work that they do over that long term? Because that's what feminism requires us to do.
Thank you.
Yeah, I think it's a really interesting question, and I think I'm not sure that we do within M&E, within my experience, I'm not sure that we do have the language to deal with that. If I think about the way we do data collection in our quantitative surveys, we're very much looking at, a binary male, female, and we're not, obviously there's no space within a quantitative survey to go beyond that if we don't give other options for people, which, to date we haven't done that in our surveys. That's why, I think qualitative is so important, again, as I said before, to open up space for people to decide what they think is important or how they feel about these issues. But then I'm not sure that in the communities where we're working that people would feel comfortable to go talk in a group or the gender roles are still very traditional and very kind of set in the way. So this is why it's important that we're doing gender transformative programming, and I hope that as the impact of our programming starts to happen, maybe we would see that reflected within the kind of data that we collect. But I would encourage, if there are any other M&E people in the room who have experience with this, I'd love also to learn, because I do think we have a lot to learn on this issue, and it's not something that we're capturing at the moment.
I could just add, the Grandmothers Advocacy Network, we've just completed a very comprehensive literature review and paper about older women, specifically in sub-Saharan Africa, and grandmothers. And it was just such a dilemma. The only language that was available in the research, well, there wasn't a lot of research about older women, but the only language that was there was men and women. And, we just found it really hard, because we feel that we need to reflect all of the gender identities, but how do you do that? I think I read in the UK, in their census, they were looking at breaking down and providing some other gender options, and they came up with 17 of them. So it's a huge challenge, but really important.
It is interesting because within the disabled people organizations that I have been working with at the field level, often the only language available was the binary language of men and women or boys and girls. Because somehow the way the disability movement have been developing has been working apart the women's rights movement, the LGBTQI movement. This is because this habit that somehow we developed of working in silos then reproduce itself and reinforce itself and we don't even realize how much we do so while implementing our projects. My experience is that not only the binary language of gender has been reproduced within the disability movement, but because the disability movement has been for a long time male-dominated, the issues related to women and girls or to the to gender-related issues have been completely overlooked by many DPOs. This is the acronym for disabled persons organizations. So much that when addressed about women's needs, girls' needs, gender-related issues, the answer is often, well, but our children, the priority for our children with disabilities is education, rehabilitation, and employment. So why are you coming to talk about gender and sexuality? That's not what we are worried about, because the world doesn't care about us yet and enough. But then working with them hand in hand, and working together with a lot of passion for both sides, there is the realization that sexuality is in the work and in the life they live every day, and therefore that you cannot split it, because otherwise because it's not true. And some very good examples of how the work on education, rehabilitation, and work matched the work on sexuality came out and were very powerful at the field level. What was interesting, however, is that because of the heavy discrimination against people with disabilities, but against LGBTQI populations, or HIV positive, the message I received was, please don't put us all in the same group, because then we will be discriminated 3-4 times more, and we have enough of our discrimination already as people with disabilities. Because there was a missing point, and the missing point was joining forces is much more powerful than working divided, but that lesson has not been learned at many levels, specifically within the disability community. But I have to say, has not been learned even within the women's movements and the women's rights movement, because if you look at how much women's rights movement have been welcoming women and girls with disabilities issues, the level is very low. And if you ask why, the answer is we didn't know how to do it, or we were not prepared, or we didn't realize we were excluding them. Well, we were not excluding them intentionally. So to conclude, the main message that comes today from groups that are working on gender, sexuality, and disability is we want to work together, and we want to be considered as peers with the women who work within the women's rights movement. Please do so and welcome us. Same for donors. And my last point is on donors. If we do not use the language that is appropriate to address what we have said today in our papers, in our policies, in our proposals, then we are automatically forgetting, neglecting, marginalizing, and that is against the aim of each of us. So let's put the language, and thanks for this very beautiful question, as a priority on how to phrase what we say and what we do every day.
So we'll just fit in one more question because you're waiting.
Oh, okay. Wonderful. There's nobody else with a question?
We'll need to wrap up soon.
Wonderful.
So
well, I will ask what I hope will be a good question. So I'm Jessica Fern. I work at CanWatch in the measuring results team. So this conversation around data and measurement is really near and dear to my heart. And you know, Sarah, you alluded to, or you said directly earlier. You talked about some of the safety concerns that you know, many of our colleagues and partners working in country will face when they try to collect some of this information. And I've heard other challenges faced by many organizations here, such as I don't know that I'll be able to get a robust enough, you know, sample size to say anything meaningful. I don't know if I have the capacity to collect some of this information. So I'm wondering from you here, and it's a bit of a selfish question. First of all, are there specific things that people in this room should know, practically speaking, about how to deal with some of these challenges that we're facing? But what can organizations like CanWatch and my team in Metrics do to support the sector to actually move from, yeah, this is a problem and we should think about it, to actually thinking, okay, what is that going to mean for our frameworks? What is that going to mean for how we do our work? What does that mean for data collection, practically speaking? Are there competencies? Are there specific strategies that we can undertake and that we can support others here to do to move to collect this information that right now is so hard to get?
thank you.
I'm not an M&E specialist, so I'm going to say things that are in the clouds, but then I'll pass it on to Victoria to actually talk about real things. I think 3 things from my perspective, and Victoria, you've talked about this: importance of qualitative analysis, and unfortunately donors are not yet equipped to deal with qualitative and quantitative data on par. The second is around, there's a report by the Office of the High Commissioner on Human Rights, and it's about the human rights-based approach to data collection. That would be a good starting point. It's a technical guidance. It's got very practical, tangible tools. And the third thing is around, it takes time. Like data collection done from a human rights-based perspective that takes the safety and confidentiality of people into consideration takes time and it takes resources. So again, donors need to be positioning themselves to allow organizations that they fund to be able to take that time and do it well and do it right.
Yeah, well, I think you covered a lot, actually. I think from my perspective, I mean, things that I touched on before, like having the resources and time and money is one thing, but also the staffing. So I mentioned that at CARE we have gender, people whose roles are focused on gender, and we also have people whose roles are focused on M&E. So having those people work together very closely is really important for us to make sure that gender is integrated in our M&E systems, and also that we have people with technical expertise in gender who can help us to figure out the best way to monitor and evaluate and to measure things. So I think for us, if we want to move beyond gender and think about other issues of marginalization, which perhaps we're not so strong at, the issues that the rest of the panel have been talking about, I think we need to learn from that expertise. So actually this kind of session where we get to come together and learn from each other is really important for that, because there are expertise out there within the health community here in Canada that we can learn from if we want to try and be more inclusive in how we measure. And I think you also mentioned like data security, and this is something that I feel that we here in our head office level, we have some good capacity around that, and we think about those issues, and we try and we're taking that into consideration when we develop new things. When data systems are developed at the country office level, I'm not sure how much support they have. So it's also making sure that we use the capacity, the resources we have within our organization in the best way, and kind of share what we're doing at this level with the field level, and learn from them in exchange. So I think, there's a lot more to be done, but I think we can learn a lot from what we're all doing already.
Thank you.
So
I'm afraid we need to wrap up because everybody needs to be able to get back to the plenary. We will be here, I believe, until the end of the day. And I think we focused quite a lot on the challenges, but there are examples that you can look for, and sometimes that means going beyond also the NGO, non-NGO, project implementers, not implementers, divisions that we make for ourselves. So just as an inspiring, hopefully, takeaway, look up Sins Invalid when you have time. It's an arts collective that is people of color in the US with disabilities who are majority part of the LGBT community, and they do spoken word and arts performances, and it's brilliant. And it is in the US, but just saying that there are these examples, and I can give you examples of similar things in Kenya and other places, but Sins Invalid is something easy to look up, and just to give you like a concrete example of something that is possible, and people who are working right at these tricky but compelling intersections. So thank you very much for joining us, and hopefully we'll have chances to chat before the end of the day.